they had found a stray dog and taken it to the vet. And when they called to ask, they said they couldn't tell because of HIPAA. Seriously. Really?
You're listening to the Help Me with HIPAA podcast, where HIPAA and humor collide to make learning fun. Your delightful hosts are Donna Grindle and David Sims. Relax. HIPAA help is on the way.
Welcome to the Help Me with HIPAA podcast. My name is David Sims of HIPAA for MSPs, and joining me, as always, is Donna Grindle of Cardin Compliance. How's it going, Donna?
It's going quite well for me today, David. How are you?
I can't complain. Wouldn't do any good, and nobody wants to hear it.
No, really, I don't. I never do. It's like whatever your problems are, you'll get over them.
Yeah, they're not too bad. But yeah, everything's going good. Not too bad. However, some things we're going to talk about today are kind of deep.
Yeah, it's gonna be hard to make a lot of this. This is deep. But sometimes you got to do that.
Yeah. So we're going to kind of depart from the entertaining side just for a little bit, because something happened in the news recently that probably you are aware of out there in listener land. Which is the incident that happened in Orlando, Florida at the Pulse nightclub, where a person went in and shot and killed a lot of people. I'm sure everybody knows the details of it. However, when Don and I were listening to it, not in the same room, yeah, we heard the word HIPAA come out. And, I was texting Donna going, did you just hear that?
Did you hear HIPAA?
Did you hear the word? Why are they using the term HIPAA? Because for Donna and I, we were both kind of scratching our heads because it shouldn't have been there. Mm-hmm. And so it was kind of interesting to see that unfold. And so that's what we're going to talk about today. We're going to dive into a little bit about what happened around that. And then let's look at some areas and times when HIPAA is not something that you need to be as concerned with, because it's all about patient care.
Yeah, patient care comes first, and we talk about that a lot, don't we?
We do.
So the circumstances, let's kind of clear that up a little bit. But the press conference was going on, and then the mayor proceeds to say that the hospitals are having trouble helping the families find their loved ones because of HIPAA. And that's when we went, what? And then later they add that the White House had done a special waiver for HIPAA releases to solve this problem, which then made it even more, what?
Yeah,
I know. I got a little angry because, I really have a problem with that, and we talk about it often. There is no reason HIPAA should have come up in that conversation, and the misconceptions about these kinds of things being a roadblock is it's a real problem for me. And it's called be reasonable, people. And granted, there's during confusion, we'll say, in a crisis, there is misinformation and there are things that go wrong. But there should be ways that we protect that, because now we know there really was no special waiver. And in fact, as David and I knew, there was no need for one. That it just didn't happen because there was no national emergency. And we're going to talk about what waivers can be done, but why there was no need for one. And there was no need for one because these hospitals could be doing what they needed to do, because patient care comes first. You're supposed to use professional judgment and all of those kind of things, and not just, HIPAA. And so, people, even in a crisis, they shouldn't be invoking HIPAA over caring for the patient properly. And the hospitals, they even interviewed them about, what plan did you have in place? What plan did you activate? How well did the plan go? They showed pictures of all of these gurneys where they were prepared. And even the hospital said, it was even more than they had prepared for. When you think about in Orlando, where you have these massive theme parks, and you never know what kind of crisis could occur with a large number of people being injured or needing care at one time, they have these plans. And in this case, this shooting overwhelmed even their plans. So, because they were in surgery so long trying to save these people. And I don't know that necessarily the details and for the clinical stuff, that's never for us. I don't do the blood that well. I don't know about you, David. But that says to me, why did they not, as part of this detailed plan that they had, why are those detailed plans not including what you do from a HIPAA perspective?
Mm-hmm.
So I kind of wanted to hit on those three things of why there was no special waiver needed, but there are cases where they can be done. It's built in. Why people shouldn't invoke HIPAA, because that puts me on the soapbox. And what kinds of things that they should be having in these plans, why don't they? So
yeah, because we typically see things like this that get under our skin, like when you go to your doctor or your dentist or wherever, and you walk up to the front and you ask a question or ask to see something that's in your documentation, and they go, "Oh, we can't because of HIPAA." You're like, "What? Yeah. Are you kidding me? I thought that's what part of what it was for, is so that I could get a hold of my own information.
My right of access. You don't understand it."
Yeah. So,
or even remember the story I told you. And I talked about this on another episode where I had somebody in one of my classes or speaking engagements that I had. There was somebody in the group that said they had found a stray dog and taken it to the vet. And when they called to ask, they said they couldn't tell because of HIPAA. Seriously. Really? People are too far down the road. I mean, come
Maybe
on.
they took it to the ER.
Yeah, I know. It's like the lady, she was in healthcare and she understood. She goes, "You have got to be kidding me. HIPAA doesn't apply to a dog." So, the misconceptions drive me insane. Even more so, particularly November 2014, OCR released a guidance, a paper. In light of the Ebola outbreak and other events, it begins, we're providing this bulletin to ensure that HIPAA-covered entities and their business associates are aware of the ways in which patient information may be shared under the privacy rule in an emergency situation. Hello.
Oh, so you could do it.
Yeah. Well, it's saying, how can you do it? What can you do? Because in the Ebola situation, they kind of threw the privacy rule out of the window because they're showing the poor guy being, put in the suit and into the ambulance and all this on TV, and they're talking about it. And, that was a public health issue, but that doesn't mean that everybody can talk about it.
Yeah, and that's the perfect point to bring up too, because we just spent a couple minutes talking about patient care overrides HIPAA, which is true, but HIPAA doesn't go out the window. The privacy rule, you can't set it aside during an emergency. It's still there.
Yeah, it's just how you apply it. And so in this paper, this guidance paper, it says a whole section on disclosures to family, friends, and others involved in the individual's care and for notification.
Mm-hmm.
So if the person is able to provide authorization, then you get their authorization. But if they're not, you use reasonable judgment about sharing information about the patient to find the people that care for them and that can help care for this patient or be there for them to help make decisions. I mean, these are necessary things. And to, well, then we throw in the media. So, but, it's not like they didn't have this information available to them. And I don't know whether it would be the mayor's office had somebody that just assumed HIPAA would be a problem. And, I don't know where that came from, but I don't want people to think that that's something that you would have to go through in a crisis like that. We've got to call the president so that I can tell my people where their loved ones are in a crisis. That's just not what's required.
That's what happens in the movies.
Oh, yeah. And we know, God forbid, it require an act of Congress because you're not going to get it. So it's designed to protect the individual, but also with the intent of caring for them properly. So yes, there's the minimum necessary. And when you get to the hospital, you have the option to opt out of their directory, the hospital directory thing. That's you can walk up to the ladies in the little pink suits, the little volunteer ladies. I always like talking to them. They're always so friendly. And I say, it's so-and-so in the hospital. If you're willing to be on the directory, they can tell me that person's name and what room they're in. That's it. They can't tell me much else about it. So those directories are there for a reason. And then, I get involved in these questions where people are like, why can't I say whether somebody's here at a hospital or not? Well, it's the media. And maybe they're just calling around looking for where somebody is that's a VIP. And they ain't got no business in my stuff. I don't care who you are.
So you're a VIP.
That's right. That's right. Yeah. Everybody knows us. We're the Help Me with HIPAA folks.
Yeah, that's funny.
No, I always tell people that, David and I just talk about stuff and record it. That's it. It's not a big production. So, but the thing that really bothered me is number one, whoever put that information out clearly didn't understand HIPAA. Number two, HIPAA shouldn't be part of a press conference in a crisis. It really shouldn't. And number three, this information is out there and has been out there for 18 months, longer than that, November 2014. It's full details, everything. And it even discusses safeguarding the patient information in an emergency situation to implement reasonable safeguards against intentional or unintentional impermissible uses and disclosures. But it's talking about being reasonable and worrying about what's right for the patient. And if you make a serious judgment that you believe that this person that's panicking in front of you actually is looking for a loved one in a crisis, I would think it's reasonable to believe it's okay to help treat that patient and care for them. What about you, David? What would you do? What would you do if you were a parent of one of those?
Are you gonna back me into a corner?
Yeah, I am. What would you do? I mean, you can imagine those parents going to the hospital trying to find their kids.
I'd go ballistic. They'd probably have to end up locking me up.
He got arrested under HIPAA.
Why'd you get arrested? I can't tell you. HIPAA won't let me tell you.
HIPAA won't let you. So, yes, that's the big thing. And there is a whole part for public health and national emergencies. And the way that it works is that somebody declares a national emergency, and HHS doesn't necessarily declare a national emergency, but the president or the secretary declares when we might suspend certain parts of HIPAA in a emergency or a disaster. And the secretary of HHS declares a public health emergency. They can waive sanctions and penalties, but it doesn't mean everything goes out the window. So again, if the patient can respond, then give them the option. And if the patient can't respond, then do your best to care for that patient in the way that you feel is necessary.
It almost sounds simple.
I know, really? But we're definitely, we will, of course, have a link to the bulletin, HIPAA Privacy in Emergency Situations. That bulletin, HIPAA Privacy in Emergency Situations. It would be a very good idea if you are in a hospital environment to make sure that this becomes part of your emergency response plan, I think anyway. That you have people that understand it, and you don't start running around invoking HIPAA because you're in a hurry. And I know a lot of people are like, it's so much easier. I'm worrying about caring for the patient. It's so much easier for me to just assume I can't say anything. And I understand that. But at the same time, remember, like our tagline, It's not about compliance. It's about patient care. And sometimes having someone hold your hand when you're laying in the emergency room terrified is caring for the patient.
Mm-hmm.
So that's a lot of that deep stuff that we talked about, is what is it that's actually there. But we will provide links to all of the guidance about the national or public health emergency and how those provisions work, as well as the bulletin that explains HIPAA privacy in an emergency situation. And it's even if you're in a small office. I mean, what if you work in an office and somebody goes berserk in a state that has a concealed carry law?
Mm-hmm.
You know, what are you going to do?
Can't tell you.
I don't know.
Because I can't tell you. HIPAA won't let me tell you what I'm going to do.
You're going to pull out that guide I just told you about, David. That's what you're going to do. Knowing that what you can and cannot do. You should. It's realistic in today. You know, if you have an office where people come and go, now that's the key. If you have an office where people come and go, that these are realistic things to consider. I'm not saying have a huge meeting and all of this kind of stuff, but these are realistic things to consider and to know where to turn.
Mm-hmm.
Now we're going to have people calling us. Oh, that was a bad idea. Yeah, we call it the panic number when people call us. But
what do you think about this scenario where you have, let's say, a municipality or some other organization where they provide their own health care? So now that makes them a HIPAA entity. And then they have an incident. Like, I'll give you a good example. We had, about 2 years ago here, we had a place of employment where they were providing their own health insurance and all that. So they were clearly a covered entity. And a disgruntled husband came in and shot his wife. And of course, being a small town, the media frenzy was crazy. And so how would they handle that differently than a healthcare environment?
Well, when the media is its own little animal that you have to worry about, because here's another this article that we have, and we'll share it with you. And it actually, one of these situations addresses something similar to that, but it goes back to that directory information can be disclosed if you identify the patient name, unless the patient has been, gotten themselves and said, no, I don't want to be in the directory. You can't call up and say, tell me about that gunshot victim.
Right.
But they're only supposed to be saying things that are necessary to identify, locate, or notify individuals responsible for the patient's care. But the media calling you up and wanting stuff for their own report, that doesn't fall within that. It is, hey, we have a Jane Doe, and here's the information we have about it. And please, if you know anything, please give us some information. We need to care for this individual. That's different than, hey, tell me about that gunshot victim. Mm-hmm. And so in your scenario, where you have a member of the press calling up and it's the media wanting to know the details, if they specifically know an individual's name, they can call the hospital that's treating them, but they can't just call up the municipality and say, hey, tell me about your employee. And they start telling about all of the, here's how bad it is and here's what happened and those kind of things. So there's only certain things that really, if you think within reason, what would they need to know? Nothing. They need to know this happens, and they need to know the patient's being treated there, maybe. But if they called, they probably already knew that.
Yeah, because in that situation, there's no crisis or public health situation or anything like that going on.
Yeah, and some hospitals will even say, look, our policy is we're not going to have a directory. We're not going to give those things out. So if you call up and you ask, we say we don't share that information. Even if they're not here, we don't tell you they're not here. And so they say, well, why would you have that policy? Well, if I tell you they're not here and all I do is call around to all the hospitals till I find somebody that says, I'm not going to tell you anything. Well, that makes it pretty easy to figure out where they are, you know?
Mm-hmm.
So that's why, if that's your thing, you just don't tell people when they call and say, hey, do you have this patient? Do you have that gunshot victim? And if you are, even if, let's say you're a practice in like your municipality and just any medical practice and you have that happen, you know, OBGYNs would have to worry about this. That, you know, a disgruntled husband or boyfriend or whatever comes in and shoots somebody for whatever reason. And that's not a far out concept today, you know?
Mm-hmm.
And the people are sent to the hospital. The doctor's office where it occurred cannot release that information. There is no reason the press needs to know about this. The details of the patient, what the patient was there for. You can't turn around and say, well, you know, Mary Jones was 6 months pregnant and her husband found out it wasn't his and she was here and he got mad and came in and boy, he pitched a fit. You know.
But somehow that hits the news faster than they can sign the waiver.
I know, really. So, but that is, you know, if those details got out, the only way those details could get out would be people in the office that have no business telling them, or the two individuals somehow told it.
Mm-hmm.
And so you know when those things happen. But, you know, talking with the media needs to be something that is reasonable and appropriate. And I think that's what everything with HIPAA we keep going back to is using reasonable and appropriate standards and reasonable and appropriate judgment.
Mm-hmm.
If it's not good for the patient, don't do it. You know, it's what it all goes back to. If you can't be sure this is going to be good for them, don't do it.
Right.
So there you have it. That's what I say. And the same thing goes for law enforcement. You know, you used to be a part of the popo.
Yes, I used to be the popo.
David is the popo. I'm glad I never encountered you. I think I would, you know, started laughing at you right away. Ma'am, do you know how fast you were driving? No.
I never asked anybody that.
No? It doesn't matter. It's not a question, right?
Yeah. I didn't want somebody to go, well, you should know that. You got the radar.
Because that would happen to you.
Yeah, it would.
So, but in that case, let's say that you bring in a patient to the ER, ED, whichever, as we've talked about, interchangeable, emergency room, emergency department. You as a law enforcement individual, you bring them in and they're unconscious. And so then you are asking the hospital about the patient status.
Mm-hmm.
So now, what should the hospital do? And I've even given you this answer, so I'm going to try to see if you can handle it.
You try to see if I can handle it.
Yeah. Disclosure is in the patient's best interest, and law enforcement official represents that, number one.
Whether or not the PHI is needed to determine whether the person has violated the law.
Right. So, I mean.
Would be number one.
I mean, you think about that case. I mean, well, okay. The information, maybe their toxicology, alcohol level in a car accident. Okay, I could see that. What's another one?
PHI is not intended to be used against the patient. Well, then.
So, okay, let's go back to the first one. It's whether another person violated the law. So I can't tell you about that because it might be used against me. So did another person violate the law? What's the bullet that's in you? I don't know.
Yeah. Where did that come from?
Yeah, you got to get those situational things. So the PHI is needed to determine whether another person violated the law, but it's not intended to be used against the patient. That gets complicated. Go on.
Yeah. An immediate law enforcement activity depends on disclosure. So that would be like a blood test for DUI.
Well, or information about where the patient was injured or whatever allows them to go capture or save somebody else. That'd be a big thing.
Mm-hmm. Or if you're charging somebody with a crime, I mean, there's a big difference between, assault and battery and murder.
Yeah, big time. And then the last one.
The last one is the activity would be materially and adversely affected by waiting until the patient's able to agree to the disclosure.
Yeah, so those are decisions that have to be situational, and those deal directly with law enforcement. And you and I have talked about it before, how hard that can get, because, law enforcement wants to know what they want to know.
Mm-hmm.
So it needs to be part of, if you run an ED, I am sure that somewhere along the way, this part is included in the decision-making of who has to make those decisions when dealing with law enforcement. And it can be very, very tricky. So it's actually way more tricky dealing with law enforcement than it is the media. It's easier to say to the media, no.
Mm-hmm.
And it covers things like if somebody calls up and says they're a doctor calling, if a person could reasonably be fooled by that, then go with it. But don't be silly,
So if he's like Dr. Feelgood.
Yeah, I know.
Or be like, I kid you not, this is years ago, you'll love it. So I get a phone call and somebody says, I need to call to verify your son's appointment to see Dr. Goodbar.
I know.
And I was like, whatever. And I hung up the phone and they called back. Come to find out it was a new dentist at the dentist office and his name was Dr. Goodbar.
See, David always finds a way to bring in something like that. So, we started out worrying about how deep this is, and it is a very serious situation that brings it up. But I think that it was something that we needed to talk about, and you were able to make it goofy along the way. So
yeah,
let's start calling David Goofy. How about that? Big long ears.
Do not have big long ears. Well, I'm cutting this show off now. You've run too far. See, that's what happens when I don't keep the leash on you.
I know. See, and I'm the one that's supposed to be the serious one.
So I guess maybe we need to do an episode about dealing with law enforcement and HIPAA.
I don't even know sometimes the right things to do, and I have the greatest respect for people that have to deal with those cases in those emergency departments over and over and over. And I'm glad that's not my specialty, is all I'm saying, because the privacy officer in a hospital with a busy emergency center, we have here Grady, which is a premier trauma center, and I can't imagine how hard it is to make these decisions day in and day out. So I don't take them lightly, and I don't think it's easy, but I also don't think it's something that people should take it as the easy way out. Mm-hmm. Is understand that we know that. But again, we're trying to do what's best for the patient. So there needs to be a plan. Right. That's all we say, Stan.
Make a plan.
Yeah, and get the guidance. That's it. Just pull the guidance and put it into your training, and so that everybody knows, even in smaller environments, you never know when these emergencies are going to happen, and things could come of it. You just don't know. You don't know. I could see a billing company, somebody showing up to pay a bill, because that happens, and bring a gun because they're mad because you're billing them. You never know. I don't assume.
All right, I'm glad of that. All right, so that's our show for today. If you enjoyed today's show, let me know. Don't talk to Donna. Anyway, you can review us on iTunes, share it out on your social media channels. You can also visit us on the web at helpmewithhipaa.com, and that's where the show notes will be as well. So head on over there if you're not already there listening to this, and get those downloads and PDFs that we'll have in the show notes for today's episode. So anything else, Donna?
No, I think I'm done for now.
All right, very good. So we'll talk about your goofy comment when I turn my mic off.
We'll be discussing goofy later.
We will do, yeah. Okay. I'm not going to Disney World with you. So anyway, remember that HIPAA is not about compliance. It's about patient care.
You've been listening to the Help Me with HIPAA podcast, hosted by Donna Grindle and David Sims. The show created to help you with HIPAA. For more information or to ask us a question, visit our website at helpmewithhipaa.com. Neither Donna Grindle or David Sims are attorneys, and they do not offer binding legal advice concerning regulatory compliance. The information in this podcast should not be relied upon or construed as legal advice in any way. Consult your attorney for legal advice concerning compliance with HIPAA regulations.